Great to see everyone for day two. Marty, thanks again for having me back. Joan and I were actually on a panel yesterday on healthcare, so we go way back in terms of conversations. We actually had a little bit of a preview of the conversation yesterday, which is great. So some of the general healthcare topics feed into this. Just quickly, and good to see some familiar faces in the audience as well. I'm Dave Whelan. I am health tech entrepreneur, investor, consultant, ecosystem builder, and it is very daunting to be moderating a panel on women's health where all of the panelists are women, and I am a guy, but so I will tell the story. So I have actually worked in helped to incubate something called the FemTech Salon in Los Angeles a couple of years ago. I worked with Women Founders Network and Women in Bio. Cheryl, it was good to hear you talk about Genève. So when I worked with Women Founders Network the first time, I was coaching Genève on Jill's pitch for Women Founders Network, which she won. And I walked into the pre-conference or the pre-pitch meeting, which I'd never done before. And I was in this huge law firm boardroom, and there were like 35 women and like one or two other guys besides me. We all had to go around the room and actually kind of guest pitch the companies that we had been coaching, which I had no idea. So they came around to me, and I knew no one, and said, hi, I'm Dave Whelan. I'm here to talk about Genève, and I'm really here to talk about vaginal dryness. And every woman in the room looked at me and they were like, who is this guy, Dave Whelan? And but good for him to talk about vaginal dryness. So there's my connection to women's health.
Excellent.
So we can talk about whatever we want to up here. No holds barred. Anyway, really excited, and we're gonna kick off with Mitzi, and just give us a little bit of sense of who you are. You've done some incredible things in entrepreneurship, in women's health, women's entrepreneurship. So give us the abbreviated story of how you got here.
Well, I don't think I can top that, so I won't even try. So I am a board certified internist with a focus on women's health. I was founding medical director of the Iris Cantor UCLA Women's Health Center, which was a Department of Health and Human Services Center of Excellence, and then was vice president of women's health at Humana. Fast forward about 5 or 6 years ago, pre-pandemic, I was being curbsided, what we call, for my medical expertise, and by these women who could not find solutions in the healthcare system or the marketplace for their own healthcare issues. And the light dawned on me that this was how we were going to advance women's health. And I literally wanted to be invested in it. So I joined Golden Seeds, which is an angel investment organization that focuses on women-led founders. We have a health sector group that I co-lead that looks at everything from life sciences all the way to wellness, therapeutics, medical devices, et cetera. Obviously, my sweet spot is women's health. I'm also on the board of the Black Women's Health Imperative and Springboard's Women's Health Innovation Council. And finally, shameless plug, I have a podcast, Beyond the Paper Gown, looking at all these factors that impact on women's health.
Terrific. Thank you so much. Yeah, Springboard is another great organization that does some incredible work. So now we'll just go down the line. So Susan Sly, the pause, please tell us your story.
Well, I'll probably quote Cheryl about 6 times, but not your intro, Dave. So it's an honor to be here. I have been working in AI, actual real AI, for the last almost 7 years now. Previously, I was the co-CEO and co-founder of a computer vision company, and under my tenure, we did the largest deployment of computer vision at scale, both inside and outside the store, that have been done in the United States. And prior to that, going back to 92, so aging myself, I was working on early facial recognition algorithms, and then I went into the holistic side of healthcare and big, Cheryl mentioned so many aspects of, can a company generate sales? Do they have the infrastructure? I love what you said about the COGS. I mean, I was just like cheering back there, because the the cost to deploy these models and, you know, how much of that budget ends up in R&D and so forth. So I have a tremendous amount of experience both in the real AI, not the PowerPoint AI, real AI, and the healthcare side of the house. So I had been asked to go to New York during Fashion Week and speak on AI and the future of AI and women, which was like an arm twisting, sure, I'll be there moment, by Hewlett Packard and NVIDIA. And one night we were all on the party bus going to the Bajla Mishka show and drinking champagne. And the conversation wasn't around GPUs. It wasn't around latency. It wasn't around so many things women in AI might talk about. It was actually what you talked about, Dave. And it was talking about how little sleep did you get? And are you having hot flashes? And one of my girlfriends said to me, could you solve this with AI? The problem is the data disparity. So we know for menopause specifically, there are 50 million women in menopause in the United States. It is the only inevitable healthcare condition we will all face as women. Not all women will menstruate. 1.3 million women enter menopause every single year. The data is, we talked about it, you spoke about it. The data is, not only is it unstructured, it's grossly inaccurate. Heart disease for women in menopause kills more women than all the top 5 cancers combined. 70% of that data set is from middle-aged white men. I am not one. So that is a problem. Our generative models are producing recommendations based on faulty data. So what we're doing at the pause is we're starting crawl, walk, run. I'm also an angel investor, I should mention that we are creating our own data with an application platform. That data will be structured. We're gathering it from wearables. We're gathering it through gamification interaction. And that's what I'm in charge of building now, which is fun.
Perfect. Thank you so much. And that's, we definitely touched on some of this yesterday around data disparities. And I definitely want to come back to that because it's so critical. We're going to go from one end of the spectrum to the other. So, you know, Regina focusing on the maternal health. So tell us your story.
That's right. Hello, everyone. I'm Regina Atim. I'm a pharmacist by background, and I am focused, my company is Clinicians Touch and Believe, which is a company that's focused on bringing forth digital medicine to assist with maternal health. We've talked about all of the disparities, I think, over the last few years that are associated with maternal health and the mortality rates that are going the wrong way. And so being a patient safety advocate and activist in a way, you know, I thought, how can I leverage some of the experience that I have in informatics and working with EHRs and digital medicine to maybe perhaps mitigate some of the angst that is occurring around just the maternal patient experience. And so that's what prompted me to create Clinicians Touch and Leave. We're in the starters. We're still in the starting stage. We're developing the application. So all of this information that I've been hearing today is very informative and it all makes sense. And, you know, just coming from the data information space, I do understand that there's a lack of standardization currently. And I feel that, you know, we need to move towards that stage. And so that's what I'm here to do.
Awesome, terrific.
I guess that leaves me.
Joan, welcome back, day 2.
Thank you. Hi, I'm Joan Koerber Walker. I have the privilege of leading the Arizona BioIndustry Association. I also lead a 3rd generation family office and chair a number of nonprofits and are the general cheerleader for all of the innovators that are trying to make life better for people. And when Marty and I were talking about what we would focus on in day 2 around healthcare with all of the opportunities that are out there, I said women's health. And Marty said, well, is that even a thing anymore? Is that hot?
That's our fighting.
I have 2 sisters.
And the answer is, it's not hot enough. And so, you know, what you heard from my fellow panelists is that this is an untapped opportunity for 50% of humankind.
51%.
And as we were preparing for this, I had the opportunity to pick up Phyllis Greenberger's newest book that came out just this year, and it's called Sex Sells. And before you get really excited, this is not 50 Shades of Grey. It is a book looking at the biology of men and women and how physicians, the healthcare system overall, the insurance companies, and everyone else has a great opportunity ahead of them. And so, we started to find out about where life science was kind of faltering on this when the empirical data started to show us that heart disease doesn't present the same way in women as in men. That was the aha moment for the NIH. That was the aha moment for CMS when we started to see huge differentials in heart attacks, stroke, arterial disease, and so on between men and women, especially at different stages of their lives. And so we also recognized that we had missed the boat on clinical trials because clinical trials were predominantly done on white males. So we had missed not only the gender demographic, but we were also missing the racial demographic and all of the things that went with that. And so because of that, our medicines were not as effective as they could be for the various populations. So I hope, today as we have this discussion, not only do we, engender the imagination of the family offices on why looking at women's health is important, but also for the men and women who are listening, the better you understand the differences between men's and women's health, the better your relationships will be with each other, whether you're 16 or 106.
Yeah, really well said. And I think the, you talk about clinical trials and, I think birth control pill is sort of this classic story of, who do we test birth control pills on? And, it's insane. But I think the point that you make is that, women's health is men's health is women's health. The more we can understand each other and, my wife had preeclampsia, which I didn't know what that was until she had it. And, we've dealt with that, and then postpartum depression and now menopause and all these things where the more men understand that from a spouse, from a friend, from an investor, from a partner, the better off we can be. So we've talked around all of this across all four of you, but I feel like we should really take a step back and I'll start with Mitzi again, but women's health, femtech, what is this? What are we talking about? How do we define that? Is it healthcare for 51%, or what do we really mean when we say femtech?
So femtech was coined in 2016, and it was really kind of focused on digital health and therapeutics focused on, women. But I think it's now just become shorthand for women's health innovation, if you will. So what is women's health? I think that's also the important definition. So women's health is now being defined as more expansively than just GYN and reproductive health, which is obviously very important, but those conditions, and Joan alluded to that manifests differently in women. So again, we talk about atypical chest pain or atypical symptoms in women in terms of heart disease. Well, they're atypical compared with men, but not necessarily with women. Mm-hmm. And we still know that, again, it's number one killer of women. The other bucket are those that manifest disproportionately, if you will. 70% of people with autoimmune disease are women. 80% of people with osteoporosis are women. 66% of people with Alzheimer's are women. So you can see that, again, certain diseases trend disproportionately. And then the third bucket, obviously, is reproductive health, GYN care, and those kinds of issues.
Perfect.
And I love the stats you gave, Mitzi, too, because it's this, when we think about family offices and looking at what makes a company investable, right? Do they have a problem to solve? These are not problems that are going to be solved with a point solution. So let's have a discussion around femtech being life cycle care. And I'm gonna take a different perspective because I can go all nerdy and techie and we can talk about IoT, we can talk about AI and ML and the different use cases. But what we really want to look at as a society and within communities, especially with the disparities we're seeing, is how are we caring for a woman from birth all the way to death? And we're seeing, unfortunately, a disturbing trend that's happening in femtech with a lot of companies deciding they're in femtech, much like companies deciding they're in AI, but they don't know anything about AI, is because of this adjacency effect. It's become trendy. My word of caution is femtech is not a trend. To Mitzi's point, when you're looking at autoimmune disease, when you're looking at the various cancers, that the reality is that within every one of those situational issues, there are a variety of ways to treat it. So with femtech, what we're looking at is something that I'll refer to as precision medicine. So how do we use technology to be more predictive and therefore preventative? And then should a woman have some form of an illness or a life event, how do we use technology to solve it in a way that is relevant to her? And so by the color of her skin, by the number of children she's had, or the number of pregnancies she's had, her life, her lifestyle, and so forth. And so when I personally look, and I'm going to flip back from founder to investor, when I look at the investments that I make, in addition to can the founder execute and so forth, what I'm looking for is this just a company that's doing femtech as an adjacency, in which case, no, I'm not interested. But number two, are they going to play well in the sandbox with other companies in the space, right? So to be able to say, oh, could, Regina's company and Susan's company, could they work well together going from postpartum to menopause? Today in the news, it was released that we're seeing and you would know this better than I, but the intensity of menopause symptoms is a predictor of various types of cancer and even Alzheimer's. So there are so many things we don't know. And so as a cautionary tale to all of the family funds that are watching, don't just look at this like, oh, this is a hot thing to invest in now. We're going to get a great return in 2 years. Of course you want that, but ask some different questions. We know the problems are real. They are not going away. These are not, to Dave's point, just women's problems, but are those companies going to be able to partner with other companies in the space to look at this whole life cycle of care?
Can I add something?
Yeah, absolutely.
Just to feed off of what Susan's saying, I think that when I first looked at this space, I was really worried that there'd be a lot of charlatans, if you will, supplements or things that were not evidence-based, because so many founders are, again, women who had a specific issue and are really, dealing with it and bringing, their solution to the market. We're looking at a lot more evidence-based companies, outcomes-based companies, and it's smart business. Because again, if your employees are leaving because of menopausal symptoms, which we know that the data shows that, then you're going to have attrition rates, you're going to need retention, it's going to cost more to get those individuals back, and they're in their prime of their life, in terms of their talents. And so, and also healthcare costs. And in fact, there has been, WHAM, which is a Women's Health Access Matters organization, found that if we just increased the small amount of money that we put into women's health research, we could actually get $13 billion back in productivity.
Yep.
McKinsey said that we could get $1 trillion back globally by 2040. So these are not only investments in companies, they're investments in our infrastructure, in our country, and in the economics. And so I think that those are things that I think we need to get we need to verbalize better and articulate in terms of the value proposition.
Absolutely. The Mayo Clinic said that we are losing 1.8 billion in productivity just due to menopause. 17% of the workforce, according to McKinsey, for women ages 40 to 65 want to quit their jobs. And the average age for a woman to enter menopause symptoms is 45. It's the same age that a woman enters a director or above position at a Fortune 500 company on average. So these are, you know, point solutions, and to Mitzi's point, it's evidence-based, and it's really women understanding the problems who are leading these companies to solve them.
Yeah, by the way, the economics I think are huge, and the point that I think Mitzi you were going close to is also in households, in male-female households, women tend to make a lot of these purchasing decisions for healthcare, for technology. So if they're being served better with women's health, they're also more likely to make the right decisions around men's health and their children's health. So there's a lot of dollars at stake here. So Belinda, anything to add to just the general story?
Oh, yeah, absolutely. So I agree with what the ladies have said about, what femtech is. I would add that it also takes into account the user needs, the specific user needs of women. And I think that component is extremely important, especially as you look to the holistic care of women. I think that care in general is very fragmented. And as you mentioned, just having that life cycle from birth to menopause, just being able to capture that data, being able to personalize that data for each woman, so that if they're showing up in the maternity ward and then maybe I had a friend a few weeks ago that was delivering, and she typically delivered at 41 weeks, but because she was pre-eclamptic the previous year, they decided to bring her in at 39 weeks instead of at 40 weeks. So she's sitting in the hospital just there, and that's of course not good for anyone, and because of that she's feeling rushed, right? And they started giving her all these medications that were going to bring about a C-section, which she did not desire. So having customized care, having all of that data where they could essentially say, she typically comes in at 41 weeks. Let's bring you in at 40 weeks and monitor you from there. That would have been the better decision, rather than bring her in, piling her Pitocin and all these other things, which, we're gonna get her closer to getting an emergency C-section. So that's why it's really important for us to utilize technology to help us to personalize some of this care.
And I giggle when people say, oh, and femtech, it's new. It is not new. So, as family offices, as investors, as, the people that generate and manage the majority of wealth, not just in this country, but in the Western world. We look at population demographics, because population demographics drive everything in economics. And today, the number one challenge that we have in the United States and in the Western economies is the growing cost of healthcare. What most people don't realize, and I'm going to get geeky, Susan, on the population demographics for a minute. The baby boom, which is my generation, is perceived as the largest generation. It is by far the largest healthcare spend generation, and will continue to be that way for another 25 to 30 years, depending on how long people live. Medicare is funded by the people that are working. We have a problem because Gen X is 30% smaller than the baby boom. The good news, Gen Y is bigger than the baby boom. So we just have to get through this dip. But we are going to generate.
Hang in there.
I'm a dip.
Yeah, thank you for paying, Susan. But this is going to generate a huge conversation globally on how we deliver healthcare, how we pay for healthcare, et cetera. What people don't realize is that femtech is what caused the problem. Because think back to the 1960s, when the birth control pill became commercially available, and women who were having children with pretty much very little choice at 16, 17, and 18 years old started to have children at the age of 29 or 30. And so this dip in the population directly correlates with the birth control pill. So life science, the impact of life science on our world, on our economy, okay, is directly tied back to femtech.
I'd also like to underline, it's also policy.
Yes, and that is the bane of my existence. We can talk about it.
I know.
That's a different panel.
Yeah. We could go on.
You won't be able to get birth control much longer.
Oh, that's something.
But you know, with the way Dave opened the panel, if everyone's you know what is dry, there's not anything else happening, my friends. Yeah.
Okay, Cheryl left the room.
Oil and rapeseed oil.
Yeah, okay, guys,
Yeah.
this is going on YouTube.
Yeah, and we can, and Mitzi, you started to talk about.
I want to ask a
Yeah,
question.
yeah.
So, because we've got about 10 minutes left. So, so what are the structural issues to kind of realizing where you want to be? Just, doing it from a, so let's say that in 10 years, femtech has reached nirvana. What were the steps that were taken to make it that way?
Yeah.
Maybe you guys can talk about that.
Yeah, that's great.
Because I mean, so, and the way I look at it is like, structural issues are like insurance, lack of capital, branding. I don't know, there's
Okay,
sensitivity towards topic discussion. So, maybe
yes.
give me your
Yeah,
top
from an investor
three
perspective,
and then tell me what were the steps that were taken to get
Sure.
to nirvana.
So for the entrepreneurs that I've seen, and then obviously, first of all, funding, whether it be from investment into the companies. And again, because they're women, most of them are women-led, they already have a challenge because only 4% of capital goes to women.
But I mean, the way to understand, venture capital is a very small space
I will,
of all
that's a
businesses.
piece of it.
Okay.
Second of all, is funding for research. So what's the good news is, okay, the good news is that women, if you heard about the White House Women's Health Research Initiative, which is really focused on getting more research, another policy opportunity for women's health research, because as Susan so beautifully talked about, we don't have that research. We don't even have the information. A lot of companies are actually generating that information, which is kind of interesting, but we can talk about that another time. The other piece is just it's regulatory. There are companies going in and the regulators really don't even know what the topic area is because they're just not informed. Then if they, get to that, and then they may not have a CPT code, so they can't even get reimbursed. And so that
So insurance.
So that makes it, CMS and then insurance, then commercial. But then they get into the, so they have to have some kind of hook for the provider and for the employer or the company that it will reduce cost. And part of the other challenge is a lot of these companies are censored, so they can't even advertise to their own constituency. So that's a big challenge because it does a vicious cycle. But there's answers to all of that. A lot of the successful companies are dealing with that. But now that X has taken away or any kind of bars on pornography, I guess we won't have that issue.
If women decide to continue to be on that platform.
Yeah, well, a lot of people have, or a lot of companies
Yeah.
have exited that. No pun intended.
So again, you're at nirvana. How did you get there? What were the 3 steps you took to get to nirvana?
Sure. So I'm gonna, again, I'm gonna go back to something Cheryl said, because I'm gonna speak as a technologist. So every technology platform requires infrastructure. And startups are competing in a land grab for compute and other supportive resources with the large players. And what I'm known for speaking on is AI, ethics, computer vision, infrastructure. So I'm going to take a different approach. There are a lot of great founders and a lot of great ideas, but they are never going to scale because they didn't start with the infrastructure. And if you went to Sunday school, you'll remember you build the house on the rock, not on the sand. So for me, for us to get where we're going with the pause, we actually started with a different hypothesis, which was let's nail down our architectural infrastructure first before we build. So we were very blessed to be approached by both Microsoft and Hewlett-Packard to partner with them. And so that allows us to not have to worry about competing with other companies for GPU, HIPAA compliant cloud and so forth. So that's the first step, is to secure the architecture. The second thing is, to Mitzi's point, is to create data that is structured and has meaning. So I just got back from Silicon Valley, and the feedback is very bullish on us because we're creating data that doesn't exist. And so once we have the data, then we can go and have opportunities to monetize the data. We have opportunities to build our own LLMs and so forth. But to get to nirvana, for us specifically with women in menopause, is to provide those precision recommendations that are tailored to where that woman is in her lifestyle. And I am just going to say, and you already know this, so you can sleep for this part, there's more than one form of menopause. There are actually 3 key forms. So one is surgical. I had a girl in tears. We get on a meeting. I'm heading to a very large tech event where I'm keynote speaking and hosting different things. And she was crying. And I said, what's going on? And she said, Susan, I'm so excited to meet you. I'm 35 years old. I had a hysterectomy. The doctor gaslit me. He was like, well, you don't want to have that because you won't even be able to have kids. And she's like, I do want to have a hysterectomy. She had a very high risk of cancer. And she was in instant menopause at 35. Then I had a husband reach out to me. His wife went into chemopause because she, was fine, no symptoms. And then she had breast cancer and then went through chemotherapy, goes into menopause. So where our moonshot is to really be able to get the data that is representative of the communities, create the LLM that provides the precision recommendations. And there are only 2,000 certified physicians in the United States certified in menopause. By 2030, we will have a deficit of 40,000 physicians. There are physicians recommending the most ridiculous things. Forget about whatever oil up the woohoo. We're talking about, pellets, which are carcinogens. We are all sorts of things that they should have no business doing. And we'll be able to use AI to help those women get what they need fast, and it's precise and it's accurate and it's results driven. And I can step off the soapbox now.
Amen.
Anything to add to that? Of your thoughts?
So I would add that I agree with what both ladies are saying. I think what I would add is the adoption of these solutions is something that we need to make sure that we work out, especially with our solution. We're aiming it for customers and patients. But we want them to be able to be empowered, to be able to take that data into the physician's office and that data be accepted. Mm-hmm. And so getting to that point, getting all of that data validated is going to be really important. So I think that is probably something we absolutely have to make sure we work through.
Which will tie into how we educate physicians in the first place.
Right.
And, it's interesting. Each year in Arizona in September, we have what's called Arizona Bioscience Week. And one of those events during Arizona's Bioscience Week is race of patient. And that is where patients tell their stories. And we had an 80-year-old woman who had 3 husbands in her lifetime, all 3 of which were physicians. And she outlived them all. But her story was that physicians look for patterns. And if we don't teach them the patterns, they don't recognize the problems. And so if the pattern is, well, women get a little flustered and emotional when they're pregnant, that's okay, dear. It's not really a problem. It's all in your mind. and it's not. And so, as we have a better understanding using precision medicine of physiology, and I'm thrilled that Julian's going to be speaking next because he's worked very, very closely on precision medicine with TGen, the Translational Genomics Research Institute. We've had a number of dream teams, generated out of Arizona, that it starts with listening. It starts with believing the experience of the woman, right? If she tells you that her body is not working the way it needs to work, you have to believe her and not challenge what she is telling you. And so, as stepping back now, because we're talking about investment. One of the biggest challenges when we look for talented teams is that as investors, we are looking for that investor who has a track record, who has been there and done it before and shown success. Because many women have not had the ability to either generate the wealth or been put in positions of responsibility and to gather that experience, we discount the importance of what they are trying to accomplish. And so as investors, I think at our challenge, and I think this is where family offices, philanthropy, and some new models like AZ Advances and the Arizona Health Innovation Trust Fund have the potential, because we are specifically chartered to develop the talent, develop the entrepreneurs, provide the mission-related investments so they can hit the milestones, so they can prove themselves. And that's when they become investable. And I think that is going to be very important for many of these women founders moving forward. And Mitzi, thank you for what Golden Seeds is doing in that area.
We have a couple of minutes, maybe last question.
Yeah, so actually, I think, Sabila, you had a question, I think, right, or comment?
I will comment later, but
All right.
it was touched on.
Perfect,
because I think
perfect.
it was medical education.
Got it. Well, I think one, again, just kind of, outreach to the audience in the room, audience online, how can family offices, how can investors help? What do you need help with? And we'll start with you, Missy, kind of speed round.
Sure. I think that, the previous conversation talked about how we can work together. And because, especially with angel investment, we're never going to fill an entire round.
Yeah.
So we're always looking to syndicate, and there's a really great network of other organizations or other investment organizations. I was at the New York Stock Exchange Second Women's Health Investor Summit, which was very exciting, but there is a lot of excitement in this space. Or if anybody just really wants to understand a specific topic or talk about this, I'm very happy to be available. Then get me through LinkedIn.
Awesome. See what helped you.
Yeah, I think that to piggyback on what Missy said is that it's wonderful. If you haven't seen Show Her the Money, that's such a brilliant movie. And I think that there's a lot more women who are writing angel checks, and it's great for women to be supporting women. And I would say to family offices, my advice would be that when you're looking at companies like ours, so you're doing your due diligence, you have a checklist, maybe you're using AI to decide if this company is investable. One of the things to take a look at is to really understand the unit economics, which is that women-led startups tend to be more profitable their first 2 years than male-led startups. So if I'm sure many of you have NVIDIA stock, right? So it's like, yes, we're all excited about that. And Jensen is doing a tremendous job. But if we look at our investments and say, oh, we're gonna bet on that winner, why is it that less than 2.5% of women-led pitches to VCs get funded? And of that 2.5%, women like myself, brown women, 0.1% of the 2.5%, when we have proven track records. In my last company, I grew it to a $120 million valuation, right? So why should it be so hard? So what I would say to the family offices is go back to your families, go back to your investors, find out who's passionate about women's health issues, find out which of your investors have gone through women's health issues, and start with small checks. They don't have to be, millions of dollars. Women like us will take a $25,000 check and get 75,000 out of the 25,000. It's proven time and again. Start with a smaller check, see what that founder is going to do, and then you can always up it in that round and top them up. But just test them out and be willing to write those small checks and bet on the female founders, because we will make the company more money, no question.
Love that. Regina?
Susan, amen. I can't say that any better. And I think for me, it's interacting with Marty. We've been interacting for a while. I think it's been the past 6 months or so.
Philadelphia.
Exactly. And so, I just echo everything you just said. Bet on women, help us get to the stage where you want to see us, where you feel that we will then be effective. If we're missing certain pieces, let us know. If we're part of the family and there's certain key stakeholders that you could bring in to help us, if we're teachable, if we're coachable, help us get to that stage and help us to scale faster. Because, for some of us, like myself, I know where this needs to go. I've been in the space. I can feel it. It's just, it's just a matter of time before we get there. So just like you said, small investments, just to test the waters, just to see how we perform. And, we'll definitely be able to prove ourselves.
Love it.
And sometimes it's uncomfortable to go into waters that they're murky, you don't really know. I've never done this before. I don't know how to swim. And so, there are organizations like the one that I'm involved in. There are others like Golden Seeds, where there are experienced investors, whether you're going to do it in a for-profit mechanism like Golden Seeds does, or philanthropically. We are currently we're working on building a $200 million endowment to fund early stage life science innovation forever. And imagine if there was a carve out in that endowment of, say, $50 million just for women-led companies or women's health issues. Because we may get to a state where we can prevent cancer from starting. We won't ever get to a state where we are able to prevent 51% of our population from having health needs that aren't being met. And so that is a challenge. That is an opportunity. And as you can see from the women on this panel, there are experts that are available to help you on that journey. And I want to close with, my grandmother was the first woman to lead our family office. And I remember after 9/11, where she sat in front of the television and watched and watched and watched. And she called a law firm that was helping her lead the office. And she said, I can't sleep. I keep seeing the fire trucks under the building. She said, I want to send them a fire truck. How much does a fire truck cost? Now, my uncle's had a stroke when she made a very large check in order to help somebody buy a fire truck. But the reality is women's health is our fire truck. So let's figure out how we get that fire truck rolling and help more women. And by the way, when the women are happy, so are the men.
Well said. Joan,
Thank
thank you so
you.
much, and thank you for inspiring this panel, really appreciate it. Marty, we're gonna do this again during JP Morgan week, right? Let's get the entire group back, so.
Absolutely.
You heard it here first. Thank you
Yes.
all.